Hiya folks, hope you're all keeping well. This video I've made for candidates who are preparing for the MRCPCH clinical exam, and this is gonna be on development. So in your development station, as you're all might be quite well aware by now, that's development station is the station with the maximum amount of marks, and you need to crack this if in order to crack this exam, you need to get through the station and score maximum in this station, because this is the station that basically awards you the maximum marks, and you need to get those 12 points. In order to you get these 12 points, then you've like 35% of your exams basically done. So this 35 to 40%, so major portion of your exam, they basically concentrate on development. So I just wanted to help you guys. I'm going to make this video very short and crisp. This is basically, I'm going to give you a few tidbits and ideas on how to take the history in the development station. Yeah, so I have made a mnemonic. So I've like categorized the history taking, because you enter the station, you don't have a lot of time, and you need to be very streamlined your thought process, and you should have, if you have a mnemonic in your head, you can basically get through the questions, and you can ask everything. You are not gonna miss anything. The examiner is basically looking whether you are well prepared for this exam, because you might be a good doctor. We all are very good doctors, but the examination, you have a very time frame. In that particular small time frame, you need to ask all the questions, the appropriate questions, in the development history taking station. Okay. So the mnemonic I've made, you start by introducing yourself and saying, "Hi, my name is Dr. So and so. I'm one of the children's doctors who work here. How are you? For instance, with Sarah. How are you, Sarah? You okay? I understand that you have a bit of a concern regarding Chloe, that is Sarah's daughter. So do you want to just briefly tell me what your major concerns are?" And then she basically tells you, "I am worried about her language and social skills. She's not keeping up with her peers." So you then tell her that, okay, so is it? I'll definitely be looking into her social milestones and language milestones. So prior to that, is it okay if I go back in time and ask a bit of a history? So you introduce yourself like that, and then you start with the so you just say, let's go back in time and let's see what all has happened ever since her birth. So you start with this mnemonic called, I've created this, it's called ANGS NHS, as you can see, A squared NGS NHS. So we start with A. So you say antenatally, whether it was a planned pregnancy, because many times mums here, most of the mums, especially early pregnancy, there are many cases of teen pregnancies in the UK. So they're not aware of they're pregnant, and they would have not dated their scan, or they would have never planned their pregnancy. So you just start with that question, because the incidence of unplanned pregnancies are quite common in the UK. So you ask whether your pregnancy was planned, and whether where the antenatal scans are all okay, were you healthy during your antenatal period, did you happen to take any medications, for any anti-epileptic medication or any thyroid medication, or antenatal scans were okay, jelly scan, was it okay, whether you had any infections, you had got to get admitted, or whether you happen to take a lot of alcohol. This is extremely important in the UK, because the incidence of fetal alcohol syndrome is very high in the European countries, and especially in the UK. So whether you happen to take a lot of alcohol, or whether you you had smoked a lot during your antenatal period, whether you got exposed to any illicit drugs. This is quite common. I've been working in the UK for quite a long time, and I've seen so many cases of neonatal drug withdrawal abstinence, neonatal abstinence syndromes, and they basically go on to into babies go on into foster care, and they basically end up having a lot of social problems and language delay and things of that sort. So the history of antenatal alcohol intake, smoking, and illicit drug exposure, antenatal scans, whether it was planned, and whether there was any serious infections during initial first trimester, and whether they were on any medications. This is quite vital. So you start with that. That's the A for antenatal scans and A for alcohol. That is the A squared. Then you go on to say, how was your delivery? How was Chloe's birth? So you got to end the questions very openly. So why we ask open-ended questions is that, in this station, in many times in this examination, you should allow the parent or the child to talk. They want to see if you are you're a safe doctor, and you listen to the patient's concern. Listening to patient concern is vital in this exam. So it's better all the questions should be open-ended, so that you allow the parent to talk. So, and they will describe how the delivery was, like, how was your delivery? You can just open-endedly ask a question, rather than asking, was the delivery a normal delivery or a C-section? So that's a closed question. So just briefly ask, could you describe how Chloe was born? So that's an open-ended question where she can literally tell you more. So this history is basically, you should gather all sorts of information. So better not ask closed-ended questions. So leave it openly. If you don't mind, could you please describe how she was born and how was the birth? So she will describe whether it was a C-section, or she was in eclampsia, or whether any preterm or any steroids were given, or magnesium sulfate was given. So she basically will tell you all about it. Now, if you don't gather all the information, she hasn't given you what you've been asking for, you basically ask her whether there was a prolonged second stage of labor, or and then you ask, did Chloe had to go to special care baby unit soon after birth, whether you were born in a tertiary center or a DGH, District General Hospital. If the child, just ask if she needed any breathing support, or she put on any oxygen. Would the baby cry soon after birth? So just keep these three things in mind, like jaundice, hypoxia, and hyperglycemia. Whether the baby got fed properly, and whether there was a history of any low blood sugar soon after birth. So you should definitely ask these questions: jaundice, hypoxia, and hyperglycemia, because that could eventually can cause hearing loss. Like whether they're on a ventilator, on a prolonged ventilation, that can again cause hearing loss. So they are basically, just making sure you're ticking all the boxes, you're asking all the questions to rule out any hearing problems, or whether there was any sepsis initially, whether she was maternal risk factor for sepsis, and whether the vaginal tract had GBS during birth. So whether the child had given prolonged antibiotic course, was LP was done, sepsis. So what happens is they will be given gentamicin many times, so whether gentamicin levels were all okay. These are extremely quite common in the UK when compared to the other countries, and this could be the reason why the child is having any hearing problems, and that eventually leads on to a language problem in the child. So neonatal period, how was it? Don't forget jaundice, hypoxia, hypoglycemia, sepsis, these things. Did the baby cry soon after birth? And then you can say on day 2, before the child is discharged, many times the doctors do NIPE examination, that is neonatal infant physical examination, that is head to toe examination before they are discharged. So you ask whether the NIPE was done. So the N is for neonatal period, or NIPE, that is the A squared N. N is for neonatal delivery and perinatal period and NIPE examination. Then you say what the NIPE was done, and during NIPE, did the doctors recognize anything funny in the baby, or did they tell you there was something wrong in the head shape or in the face, anything, any congenital malformation? Because the child will not be there in this examination, and you don't want to miss anything, any dysmorphic features. So you just ask about an IP examination, and then you go to the another N in mind is the then they'll be sent home. So when they're sent home on day 5, the health visitor comes or community midwife comes and does the newborn blood spot test, the Guthrie card test or the heel prick test. So the N stands for, again, newborn blood spot test. So you could say whether the heel prick test was done on day 5, did the results come out, and was there anything abnormal? Because one of my stations, the child had phenylketonuria, and it was detected on Guthrie card test. So if you happen to miss this question, that's pretty much it. You basically lost the entire you basically missed the major question, and then there's no point asking all other questions, because if you didn't ask the history of heel prick test or newborn blood spot test, you missed phenylketonuria. That thing will not be, you will not come to know. So without knowing that, then you can't streamline your next questions as well. So asking all the questions in this station is extremely vital. So you need to get clues as to why this child is having a delay. So A squared N is for the newborn blood spot or neonatal period. And then you can also ask whether the same N you can use for newborn hearing screen. So newborn hearing screen. And like in the neonatal period, if you go back, in the neonatal period, as the child was born, you asked for, did the child cry soon after birth? Was there any history of any hypoxia? Cooling was done, HIE, any signs of HIE, or was the child sent to a tertiary center for cooling, or jaundice, hypoglycemia? You can ask for like perinatal maternal risk factors like prolonged rupture of membranes or group B streptococcus in the vaginal tract. Whether the child was given IV antibiotics for a 5 days or 10 days course, whether the LP was done, sepsis. If at all they tell you he was treated for sepsis, just make sure you ask all the questions. If she says no, it was all fine, we went home this next day, then you don't have to ask these questions. But if at all they tell you that, yes, we were admitted in special care, then just broadly think of factors that could cause hearing loss or language delay and things of that sort, like vision related problems, preterm, like periventricular leukomalacia, cortical blindness, keep all that in your head. So A squared N is newborn blood spot screening and newborn hearing screen. So definitely you need to ask these questions. Then you go to G, ANG. G is general health. General health. He's now finished his neonatal period, and up till imagine Chloe, the child who we're examining in the station, is 4 years of age. Just ask general health. How has she been? Has she had any recurrent hospital admission, or do you visit your GP very often? Just say if it is a language or hearing language related history taking, just definitely ask whether the child had recurrent ear infection. This is a very vital question. So general health, whether there's been any regular hospital visit, GP visit, or outpatient visit, or recurrent ear infection. And then so ANGS, I've put for seizures. So some conditions have seizures. So if there is a language delay and there is seizures along with it, and many times autism itself, there could be autism, the child could be autistic, that itself is a low threshold for having seizure disorders. Or you could go, sometimes it could be autism and seizure, it could be Landau-Kleffner syndrome. So there's going to be so many other syndromes which eventually you come to a diagnosis of. So never miss the question of seizures. And then ANGS is for seizures. Then again, that is N, that is for nutrition and growth. So ask how was he fed soon after birth, whether he or she, for instance here it's Chloe, so whether Chloe had to be fed through a tube initially, was she a preterm, was TPN given, was she if it's a cerebral palsy kid, there could be unsafe swallow. So nutrition wise, how was the nutrition? If it's like a Prader-Willi, the delayed feeding, NG tube feeding, whether she fed, any different formula used, any high calorie feeds were used, and then you ask about the growth, whether there was anything suggestive of, like, there could be a delayed maybe there's a child is IUGR. So when in the neonatal period, you should also ask for birth weight. If it's a low birth weight baby, IUGR, smoking, fetal alcohol syndrome. So, so that growth and nutrition is a very vital question. You need to know what was the child fed with, breastfed or not, a bottle fed, growth. Overall, there's a red book. All these babies are sent home with a red book in the UK. The red book, health visitor plots the height, weight, head circumference, and you can basically plot it onto an RCPCH growth chart. So you ask about nutrition and growth. So ANGS, ANGS, N as nutrition and growth, and then NHS. So hearing. H is for hearing. So are you worried about his Chloe's hearing and vision? Are you worried if she is able to visualize things properly, looking at you, smiling at you? So are you just simply ask an open-ended question? Are you worried about her hearing and vision? So you need to definitely ask about this. So sometimes it could be, the child has a squint. Any squint that lasts more than 6 months definitely can have amblyopia and vision related problems. So don't forget about hearing and vision. So NHS, ANGSNH is hearing and vision. Then there is finally S, that's sleep. That's for sleep. So ANGSNHS, so sleep. So how is the sleep? If autistic children find it very hard, or children with ADHD, they have very altered sleep pattern and they're very hard to put to sleep. Or if there's a Down syndrome child, he will be sleeping for long hours. If it's a congenital hypothyroidism child, that child will also be sleeping for long hours. So whether the child has disrupted sleep, so whether the health is, so if there's a sleep related issue, usually you have to contact the health visitor, who will escalate this to a GP and sometimes prescribe melatonin for sleeping. So I just wanted you guys to have this mnemonic in your head so that you basically cover everything in your history taking, and once the examiner understands that you have explored very, very extensively to find the exact cause for this delay, and these questions will help you. And if you have this mnemonic in your head, you have a limited time frame. You can ask all these questions and you have ticked all the boxes. So ANGS NHS, ANGS NHS. So don't forget about sleep. Then you ask about drug history, immunization history, that like allergy history, like all the things which you usually ask. The significance of drug history is that preterm babies who have chronic lung disease, sometimes they are giving diuretics due to the cor pulmonale or pulmonary hypertension, and we know we give for bronchopulmonary dysplasia, we give diuretics. So whether the child is on any medications like that can cause for furosemide induced hearing loss. So you need to be very specific with drug history as well. You can ask that immunization, whether vaccinated, and allergies. You can ask that. Then you go on to the next basic section, that is family history. So family history, I've made a mnemonic called CDLM. CDLM. First C being consanguinity. This is extremely vital. You ask about, well, are you related to your husband or your partner? So consanguinity. And then you ask for D. D is whether there is any similar development delay in your family. Yeah, that's another D. That's an important question. And then L is for whether there's any learning impairment, family history of any learning impairment. Just so that you think of like Fragile X syndrome, the things that run in the families. And M is for have you had any previous miscarriages? So CDLM. Have you had any miscarriages? Because imagine Chloe is 4 and is having a neuroregression, and it could be and showing autistic signs, language delay. It could be Rett syndrome, and the mother could have had a previous miscarriage, which is a boy. As you know, Rett syndrome is X-linked dominant. The child could have passed away. So there are multiple things. So always ask for this history of miscarriage, learning impairment in the family, development delay, consanguinity, and always leave the questions very open-ended. Like, are you aware of any other medical problems in your family? because cystic fibrosis is quite common here in the UK. Celiac disease is quite common in the UK. So all these things, it's always good to know. Inflammatory bowel diseases, Crohn's and ulcerative colitis. So there's so many things which is quite common in the UK. So CDLM, consanguinity, development delay, learning impairment, and miscarriages. Then you can, if you think the child in a social, if the question asks, you should explore the child's language reasons for language and social delay. If the question asks about social delay, you should always ask ask questions to rule out autism. So the mnemonic after the family history, I'm going to ask you, I'm going to tell you about the autistic questions which you need to ask. So the mnemonic I've made is ROSC me, like ROSC in APLS is return of spontaneous circulation. So ROSC, ROSC me. Okay, so R is repetitive movements, right? Repetitive hand movements, hand gestures, or repetitive language like echolalia. Have you noticed the child to have any repeated movements, stereotypical movements in hands, or is she having echolalia? Like, does she repeat her words, sentences, or does she have something called gestalt speech, where the child copies what she heard from cartoons? It will be appropriate for a scenario, but the child will not be able to make sentences, where rather she would just copy what she saw in the TV in real life, and use the same things what she heard in the cartoon in real life scenarios. Like, so that's called gestalt speech, which is quite common in autistic children. So so R for repeated hand movements and gestures and repeated language. So echolalia, gestalt speech. You can ask about that question in order to rule out autism. And then any O for obsessions, like whether they have a routine obsession to OCD, obsessive compulsive disorder, like whether they want things in a particular pattern, whether they line their toys in a line, then whether they want a particular dress to be always worn. So like an OCD symptoms, you ask for OCD symptoms. And then you ask for sensory issues, a lot of light and a lot of music. And does the child have any food sensory issues on particular type of food only she eats? Many times they don't want to mix their food. They only have a liking towards white colored food, or they don't like white colored food. So they don't like the the food to be mixed many times. So do they have any sensory issues? Are they very picky eaters? So autistic children have this sensory issues of having some. They don't like some of the chewy foods. They don't like sometimes very gooey foods. So so I can ask you sensory issues, and many times autistic children have recurrent UTI, urinary tract infections, because they're quite they don't know how to clean themselves, and they have hygiene issues as well. They want their nappies to be always changed, so they make tantrums and they don't know how to express their concerns. So they are very they many times obsessed that they want their downstairs to be always dry and not wet. So and they don't know how to tell you that they've wet themselves. So they have sensory issues like skin related, like when they have a full bladder and they have sometimes had an incontinence. So they want their nappies to be always cleaned. So they have sensory issues like that, of not being able to express that they've leaked themselves. That's a major reason why autistic children are delayed toilet trained. Toilet training is very much delayed in such children. So you can ask about these sensory issues, and when you go to ROS, the obsession, you can also ask for any comfort toy. Like they have an obsession towards one particular toy and they want that in their hand whenever they're going to sleep, or whenever they're going outside, they need that particular toy. It could be a very inanimate object, like maybe a screw, or maybe even a block, or a teddy bear, something of that sort. So ROS is repeated movements, obsessions, OCDs, any sensory issues. Then C is like struggling to cope in a new environment, whether you've changed house and she has not liked the this new change in her living environment, how she in school, whether the new school has caused a lot of problems. So struggle to cope in a new environment or a change of a routine. So see if at coping in a new environment or change in routines. Then M is like, having major tantrum and meltdown. Like, sometimes they cry for very long hours because they didn't like something which is a new into their life, or major tantrums and meltdowns. So M is for meltdowns. And then E is for eye contact. So as you know, they have very limited eye contact. Sometimes they have a little bit of an eye contact, but it's not sustained. It's not like a proper, during conversations they might just briefly give you an eye contact for 2-3 seconds, but even that counts as autistic because it could be in the minimal spectrum. So a proper eye contact. And then so E is for eye contact and not responding to emotions, like when you are emotionally having, when the parents or siblings are emotionally having problems, they don't give any interest, or they don't give a crap about the emotions in adults. So that is for eye contact and emotions. So you can basically make a brief mnemonic like this and make sure you ask all the questions. So we asked about the past history, like birth, antenatal, natal, perinatal, and then past history up to what particular age of Chloe. For example, we are examining Chloe, who's 4 years of age. So past history. Then we went to family history. Then we have asked the autistic questions. Then there is another set of questions which you need to definitely ask. That is, I have put a mnemonic called RHLM. RHLM RET. Yeah, RHLM RET. This is another set of questions which you need to definitely ask. So R stands for regression, developmental regression. Do you think that, you can ask, like, do you think that, if the child did really well till 2 years of age, and then all of a sudden from 2 years of age, she's going backwards and she's lost the milestones. So do you think she has regressed her milestones? So any signs of any neurodegenerative disorders, this is a very vital question. So development regression. Then H for hand preference. So do you think that, she's only been using her right side from a very early age? So hand preference. Then L is for language spoken at home. This you should definitely not forget asking if it is a language related issue. Language is spoken, it is quite common in the UK here. Multiple bilingual languages spoken at home. Or if there is any concern, if there is a cerebral palsy kid who is not at all speaking, you can ask if the child needs Makaton speech or PECS, pictorial PECS is actually pictorial exchange communication system. So some children are so they have so much of cerebral palsy. They have only receptive languages. They don't have any sort of expressive language. So there's a device which is used for such bad debilitated children here called PECS, Picture Exchange Communication System. So you can ask if there's a multiple languages spoken at home, whether the child needs any sign language or Makaton to be used, or if the child needs PECS, PECS, Picture Exchange Communication System. So RH, regression, hand preference, language. Then M I have actually put for Makaton, like sign language. So languages spoken, multiple languages spoken at home. Then M is for Makaton or PECS used. Then you have RET. So the coming letters RET. R is for, up till now, has this child been referred to any other professionals like allied health professionals, physiotherapist, occupational therapist, or any other referrals being made to community pediatrician or any tertiary center neurologist, metabolic doctors, or geneticist? So you just make sure that the child has been already referred. So you ask for history of any referrals being made prior to this clinic appointment. Then ET stands for, do you know if the child has any EHCP planned for the child? That is early health care plan. So wherever the child is, whichever school she's going to, or if the health visitor recognizes, or if the doctors are concerned about this child's development, they can ask for an early health care plan, EHCP. It's basically a care plan where you basically tell this council in which the child is staying. So every child who's in a particular county has a council. So imagine there are many counties like Manchester, Newcastle, London. So in which county you are, and the council will provide free education to your child. So the council will make sure there are funds released for your child, for your child's development. They will allocate funds to bring in all the professionals who can help this child. So that's called EHCP. So just ask if the child has an EHCP plan, or if there is some children from a very young age have a very particular diagnosis, and then you can ask if the child has any TAC, that is team around the child. So R for referrals, E for EHCP, and the last T is for TAC. Does the child come under a TAC? That is a team. Is there a team around the child? Is there a specific group of doctors and allied health professionals who work around your child? So that is RHLMRET. This is another set of questions you definitely need to ask. Moving on, the next category of questions is social history. In social history, I've made another mnemonic called SPRFHEC. So SPRFHEC. S is for school. How are things at school? So is she going to mainstream school or a special education needs school? And then is there a SENCO? So SENCO is a professional called Special Education Needs Coordinator. So she will arrange everything. If the teachers concerned, if teachers are concerned, a SENCO in a school will prepare, will alert the council and make sure funds, an EHCP plan is in place, and whether the funds have been all arranged, and they will make sure if the child needs an occupational therapist, they arrange things for the child in school, make the learning environment easy for the child to get along with, and make things easy for the child to socialize. And if the child needs an educational psychologist, they will bring these professionals into the school and help the child get development for a better development. So whether there's any SENCO involved in your school for your child's development, are they going to mainstream school or a special education needs school? So that's S. P is parental mental health. You ask the mother, are you mentally keeping well? Are you emotionally well? Are you going through a rough patch? Are you depressed? So the parents' mental health will be reflected on child's development. So P is for parental mental health, whether you have any psychological support and things of that sort. And R, so SPR, R is for respite. Do you have any respite care arranged for you if the child is very developmentally delayed and needs full-on attention from the parent? They will be psychologically depressed many times. So do you have respite care arranged for you? Then F is for family support. Do you have a family that supports you, or is there any support network in place for you? If the child is a Down syndrome child, is there any support network? Are you in touch with other parents who have the same, who have a trisomy 21 child? Or there are many support groups. So are you aware of any support groups? Do you have a family? So you basically ask for a family support network. Then housing, H is for housing, which is how's your housing? Are you happy with the house in which you live? Then E is for employment. Are you employed? Do you have enough financial support and financial aid to look after your child? And you can ask if the child is seriously developmentally delayed or any other concerns, debilitated. So many times you get DLA, disability living allowance. So you should always ask if there's an EHCP plan in. Do you have DLA arranged for you, disability living allowance for your child? And then that's employment and financial things. Then the last CHEC is for children's services. So whether there has been any safeguarding concerns, whether the child has been, whether social services are involved, children's services, you should expand your questions and you should ask for if this, whether there's been any marital discord or any domestic violence or any safeguarding concerns. So these questions are extremely vital. Many times the IMG doctors don't ask these questions in the development station, and you might tend to lose marks. So they might not give the entire 12 marks. You would have done really well, but sometimes they just won't give you the entire full marks because of these little nuances, these things which you've not explored. So a British trainee who does the exam here, they might be a little more aware of these things when compared to an IMG doctor. So that is why I basically made this video and these mnemonics, which basically can help you guys. And these questions are extremely vital. It's not. Yes, you need to ask when the child sat, when the child lifted head, had neck control, when the child sat, when the child cruised, when the child had a shuffling or a crawling, command to crawl, or bottom shuffling. You need to ask all those questions as well. But and we might do really well in asking all those questions, but I feel the questions which I've highlighted here, these mnemonics and these questions, are also very significant in this station, and I feel these questions are to be definitely asked in order to crack the station, in order to get through the station and score maximum marks in the station. I hope this podcast has helped you guys. You can also make your own mnemonics, and you can use my mnemonics or like jumble it up and make your own things, your own mnemonic to keep things in your head, because you only have a specific time frame of 22-minute station. So you need to quickly ask all these questions, and the examiner should know that you have explored thoroughly in order to find the exact cause for this. So my one station, I can just share my station which I had. The child mom had a lot of alcohol, and it was a fetal alcohol syndrome case, and the child had very severe ADHD symptoms. So there was she was a foster mother, so she didn't know who the biological mom was. So you should never say the real mom in front of a foster mom. You should say, do you know who the real mom is, and do you know about the family history of the real mom? So it was a fostered child. Sometimes you're speaking with a mother who's a foster mom, so you might not get much of a history about the family. Sometimes they do know about the real mom's family background. So mine was a foster mom, was there was severe alcohol intake, and it was a case of fetal alcohol syndrome, and I had to explore all these questions. I hope this podcast has helped you all, and best of luck. Do make sure you prepare the development station really well, because this is the station that can fetch you the maximum marks to crack this exam. Thank you. Take care.